Good morning, everybody. It's Dr. Brace here at Guelph Facial Plastics, and today is Facial Plastics Friday. Today we're going to talk about facial trauma. So as a facial plastic surgeon, I not only perform aesthetic facial medicine and aesthetic facial surgery, but I also perform reconstructive surgery. And often that's broken jaws, broken facial bones, and sometimes it's facial lacerations. Our emergency room doctors are really good at closing up lacerations, but sometimes they're very complicated, and so they call someone like me to help them out. So today's case is a recent case that I did this past winter. It involves a patient who fell in their house and struck their eyelid on the corner of a coffee table. So a bit of a freak accident, but unfortunately the injury split this patient's eyelid right in half. So it's called a full thickness laceration of the lower eyelid. And I've mentioned before that the lower eyelid is a very complicated structure, very delicate structure that has to be respected. And so during this fall, it was not respected and it was fully torn in half. So as a facial plastic and reconstructive surgeon, my job is to restore not only the form, but also the function of the lower eyelid. And one of the functions of the lower eyelid is to not only protect the eye, but also to help pump the tear film that's on the eye through the lacrimal system down into the nose, into the lacrimal duct. And if your lower eyelid is split open, your tears run straight down your face. That's called an epiphora. If you don't correct the eyelid properly, the little canaliculus, little hole in your corner of your eyelid that drains your tears, won't be touching the eyeball itself in the right spot, and you'll have a chronic draining eye, a chronic dry eye, and be prone to what we call exposure keratitis, or redness and ulceration. So it's a very, very important thing to fix correctly. So here I'm going to show a picture of the injury. So this gentleman split all the layers of the eyelid: the skin, the muscle, the tarsal plate, which is the cartilage, and the conjunctiva, as well as the orbital septum. And so this repair requires fixing the tarsal plate primarily, the muscle, and the skin. For all the medical students and residents that are watching this, the book that I learned this through, as well as my fellowship, is this book. I've mentioned it before. It's fantastic. It goes through step by step on how to fix a lower eyelid full thickness laceration. But what you need to know for all the budding surgeons out there is that the key stitch is the one that you place on the margin of the eyelid. We use a 6/0 silk, and you put a vertical mattress stitch to cause the eyelid to not just come together, but to stand up like this. The reason we want to sew the laceration up is because as it heals, it will contract. And the common complication of these injuries is for there to be a notch. So it heals like this, and then you have exposure of the eye again. And so this was the injury that I showed. This was the repair in the emergency room. And then 3 months later, this is what the eyelid looks like. So with proper technique, you can restore eyelids back to their proper function and their proper form. And that's part of the joy of being a facial plastic surgeon, is returning people back to normal form and function, or improving their form and function, so that they can go back into the world and not have this as a memory that they have to live with every day because it doesn't work well. So everybody stay safe, have a great weekend, and thanks for watching. Bye-bye.